So this is benign prostatic hyperplasia, BPH. Sometimes it's called benign prostatic hypertrophy, but really it is hyperplasia. Uh, the BPH is an age-related, non-malignant enlargement of the prostate gland. So this isn't a malignancy. Um, This isn't inflammation. This is literally a hyperplasia. The prostate gland becomes enlarged in older men. Uh, 75% of men uh, over the age of 50 will get symptoms, some symptoms of prostate enlargement. It doesn't uh, it doesn't tend to be symptomatic under the age of 40, if it even exists. It starts to show symptoms in the 50s. Half of men over 60 have symptoms, and 70% over 70 have them. And probably it's 100% of men over like 85 or something like that. It's uh, the incidence is huge. Age is the biggest factor, but ethnicity and kind of geography, it seemed to be um, part of it as well. You know, there's lots of guys have got symptoms of this, but not usually enough that requires actual treatment, just more monitoring. Um, Really, we don't know why. Uh, it it's is it it's got something to do with um, with uh, hormones? Probably. It's probably got something to do with testosterone, maybe even to do with some estrogen. So one has to wonder whether some plastics or the ubiquitousness of soybeans, um, you know, is contributing to this. Um, it's quite possible. But what ends up happening is this enlargement really just squeezes down onto the urethra and it makes it difficult to pee. Um, so the tissue is that's affected seems to be around the urethra. So it's deep in the middle of the prostate, um, and which is different than cancer, which tends to be more on the surface. Uh, so when there is this pressure, you end up with a dysuria. Like it's hard to pee, and then the bladder doesn't empty very well. Uh, you, it might actually back up all the way to the kidneys and cause uh, problems in the kidneys. Stones can form in the bladder. Like there's a number of things that can happen, but generally speaking, what it is a flow problem. So it ends up looking like this. So so there's difficulty with urination. The 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 flow is um, not satisfying. It's weak. Uh, it seems to go on forever, and then you get incomplete emptying, which means that the bladder fills up again sooner, so you have to go again. Uh, there could be a little bit of back pressure, so there could be some leakage that can happen. Uh, this urinary frequency really has other problems, quality of life problems. It it means that you have to pee a couple of times during the night. You have to get up to pee. Um, it's almost a joke. I can attest to it as most of my friends are turning 60. I'm a little ways away from that yet, not very far, but um, but it becomes a topic of conversation. Uh, what'll happen is people, the guys will be sitting around, and when we were in our 20s and 30s, it's like, I better not have another beer because I'm going to have to drive. And now it's, well, I better not have another beer because I'll be up all night peeing. Uh, it's it's almost cliche, actually. The If you've ever noticed, middle-aged or older men can hardly walk by a bathroom without ducking in to have a little pee because they know that it's going to it's going to come about. Like, it's hard to go to the mall with your grandfather because he has to he has to find a bathroom all the time. But you can imagine that if you're getting up 2 and 3 and 4 times in the night, that it's disturbed sleep, and these people get fatigue, and those sorts of problems. Um, the if there's the if the urine can't get out at all, then it can back up and cause hydroureters, and your ureter walls will become stretched. It's almost like varicose veins, and it can be really a big problem, and it can actually cause renal failure, which can cause death if it goes really not treated. So um, it can bleed into there as well. So how do we diagnose it? So you diagnose it through palpation. The Literally, when you go in for an annual physical, it's a rubber glove and palpation of it. The If that's found, and somebody's complaining of symptoms, then they do tests for urinary speed and force uh, to see how that's working. They tend to do PSA tests it, just to see kind of how this is going to progress. It's saying that higher PSA levels are greater risk of more prostate growth. They do urinalysis to look for hematuria to see if there's any bladder damage from retention of urine. Most people just learn to live with it. They don't actually do anything about it. There's uh, there's a drug that works fairly well, and it's called Flomax, which I think is a great name for a drug that allows you to pee more, because lack of flow is the major symptom. So why wouldn't you call the drug Flomax? Um, if it gets really bad and there's problems where urinary retention is starting to cause health problems, they may give uh, different drugs that lower the testosterone, uh, which has a whole other set of effects. That anybody with low testosterone can attest to. It's um, you know, all kinds of side effects to it. So they try not to do it. In really bad cases, they'll actually do surgery. There's people that don't respond to medications, and really what they're trying to do is alleviate the obstruction to urine flow. So what they end up doing is a surgery called TURP, which is basically a camera on a catheter, and it's threaded up into the urethra, and what they do is they use a surgical instrument, and you resection the part of the prostate that's pushing on the urinary channel. So you cut away the inside. Um, there was a point where they did complete prostatectomies to it, but those are pretty radical, and it disturbs the pelvic floor and makes incontinence a big problem. The they're always on the lookout for prostate cancer while this is going on. So these things get monitored fairly closely, just to see if it would if it's going to go any further, right? Yeah, that's that's really about it for benign prostatic hypertrophy. Massage doesn't have really any effect. Can improve quality of life. Well, I think they put that in these slides whenever there's really nothing to say. Um, so it's an education thing. Risks of UTIs and urinary retention. It's all a fairly focused on education.